Hi, everybody. Thanks for joining us today on the show. And I'm really, really pleased that we've got a special guest, Emma Kenny. Thanks, Emma, so much for joining us today on the show. It's really pleasure
Pleasure.
to have you on.
Thanks for having me.
Can you tell us a little bit about yourself and what you do?
I mean, I suppose if you know me at all, you'll probably know me because you've either watched crime documentaries, which I've done lots and lots of, or you know me from This Morning or docs like, Five, anything on Channel 5. They've probably dragged me into, I've done a favour for somebody I know and been dragged in to talk about things. But basically, I suppose if you're around in the day This Morning, I'm one of their agony aunts. I write for Closer magazine. I've done that for a decade. And I also basically work for Channel Mum, which is a big mum organisation. But I mean, I get around, but my major passion is therapy. Like, therapy is still the biggest passion of my life. So the media's been really helpful because of the fact that my big obsession is to reach as many people as possible and tell people that there's always a way forward, and also to reassure people that when they don't fit into a system, it's not them that's the problem, it's the system. So a lot of the kind of opportunities that TV have given me is that opportunity to kind of have that discussion and disclosure. So for me, my history is a synergy between broadcasting now and also being in the therapeutic dynamic and trying to do as much advocacy for mental health in between.
Yeah, because I thanks for that, Emma. I don't watch, well, I watch a little bit of TV. I'm sort of like I like nature programs, and I'm not like I don't watch Coronation Street or EastEnders or anything like that. So if anybody's watching, I'm sorry, but I don't tend to watch them programs. But
you're a David Attenborough real world.
Yes,
right?
Yeah. And when I first come across Emma, because I didn't really know Emma at all until I met Emma a few months ago on Twitter. And I first come across because Emma struck me when the sad death of Caroline Flack. And I believe Caroline was a close friend to yourself.
Not a close, but she's a close ITV colleague. So, I mean, I knew her, but only like not deeply in any way. But the thing was that because you kind of know people who know her very well, you're affected by it because of the fact that it's quite a vicarious trauma. But because of my own dad's death, obviously suicide is a huge part of my life now, because when you lose a parent to suicide and then somebody that you know, even in a colleague capacity, kills themselves, you're instantly kind of transported back to the futility of that action when you wish that there were all these options that should have been available to them, or in this case, the protection that she should have been given during a period of really severe mental health crisis, and it didn't happen, and it made me really angry. And as much as I don't do myself any favors at all when I talk about that, because I talk about the press's responsibility, and obviously that doesn't go down very well when you work in it, but I think there's a really important authenticity as a human being, which is to make a choice based on truth, or make a choice based on what works for you wage-wise. And whilst that means I'll never be wealthy or never probably have a major show in any way, shape or form, at least I go to bed at night and know that I did the right thing. And I think that's always going to win for me. So I suppose that when you think about autism and you think about that particular statement that I've just made, I think that people with autism will completely understand that synergy, that idea of just feeling completely uncomfortable with doing something that doesn't feel completely congruent to who you are and what reflects who you are in that way.
I think it's really important to talk about mental health issues because, it doesn't get taught enough about, and a lot of people still, brush it under the carpet and shy away from it. And I think it's really important. I'm so sorry that you lost your father to suicide, and your colleague Caroline. And for me, I only come into a really, I would say, a very tricky scenario. As I remember last year, I was at Telford and I was crossing over a bridge to get to a shopping complex, and all I saw was from a distance was a 21-year-old man stood on top of the bridge, and he was about to jump off the bridge. And I thought, what do I actually do here? But I think as human beings as we are, another system sort of takes over, and I just remained. I can't believe how calm I remained. I remained really calm, composed, and I didn't really approach the guy. I stayed from a distance, and he was having a domestic with his girlfriend on the bridge. And all I could hear was this girl crying and sobbing and just saying, "Don't do it, don't do it. You know, I love you. Don't do it." And he just said, "You know, that's it. I'm just going to take my life." And I just stood back from an outsider and said, "You know, please don't do it," and just started talking to him calmly and softly and just saying, "You know, please don't do it. You know, you've got your whole life ahead of you. You know, you don't want to do this. You'll regret it. Think about the people you're going to leave behind." And eventually, at that time, I didn't know what to do. So I just got my phone, turned my face the other way, and called 999 and said, "I need police, ambulance, and fire. I need the 3 emergency services." One, because he was on a bridge.
Yeah.
2, there was, you know, it was, you know, in the evening, and it was about 5 p.m. and the traffic was horrendous.
Yes. Yeah.
And you can imagine if he jumped off and the fatalities, what would cause not just himself but the people, you know, on the dual carriageway. And within 5 minutes, all 3 emergency services come out. But eventually, before they came out, he did come off the bridge. And, you know, the relief for everybody, because he stepped off. And he, you know, he just broke down into tears. The ambulance paramedics were on the scene straight away, and they took him in for a mental health assessment. So for me, I've only ever been in a stage of my life where, you know, I've come into contact where, you know, somebody is going to take their own life. But I think, you know, as general in society, people don't talk enough about mental health, and they don't, you know, when somebody's suffering, a lot of people suffer in silence and they don't talk about it.
Totally.
Why do you think that is, Emma? Why do you think people who are suicidal don't? I know that's probably a difficult question.
No, it's not. It's difficult in the fact that obviously I would never pretend that everybody's situation is subjective. And when you think about suicide on multi levels, there are different rationales behind it. So I would never, for example, criticize somebody who is terminally unwell or is somebody who is in prolific pain because of something that's not going to be healed, who chooses to go to Dignitas, which is suicide. But I think that that's a really good death. So when you look at suicide per se, there is an element of suicide being rebellion against a situation that they've been presented with, and one that they can soothe their way out of the world in a very calm and peaceful, loving way, surrounded by people that adore them. That is a good death, whether it's suicide or otherwise. But then the majority of suicides don't come because of that prerogative. They come because of either what you were talking about there, a single moment of deep pressure, a culmination of a very bad day, an argument with a girlfriend, and an immediate reaction. My sister lost a girl from her class 6 months ago. She had a really bad morning. She got up after an argument with the teacher and she threw herself off a bridge within a minute or two of leaving the classroom. That decision was based on a really bad day. So this idea that you have to have an accumulative effect for suicide, again, is something that we probably need to explore more, because the truth is that there are lots of people who take themselves away from this world in an impulsive moment. But I suppose for the majority of people like my dad, there are different reasons why I think we don't talk about mental health, and certainly which leads to suicide. If you're of a certain age group, my father didn't even believe in mental illness. He saw it as something that probably was just a personal weakness because of his age demographic. So psychosis after a period of delirium is very, very scary and also very real. So people hear, smell, see things that feel like people are in the room. That's terrifying. So in his case, he felt that there was never going to be any reason to be well because this was the world he was now inhabiting. And that was a failure catastrophically of the mental health system from start to finish, an abject, insulting failure of a man who should still be here. And that's the reality. When it comes down to younger demographics, the problem with being an emotional, cogent human being is you get people who go on television and call them snowflakes. So therefore, when somebody has a mental health issue and even dares to talk about it, they're greeted with the fact that somehow they're lacking in something because they struggle with their emotions. So that's the very clear media perspective and slide that they have. On top of that, when you look at the mental health system in the UK, and this is not to do down any clinical psychologist or psychiatrist or wellbeing officer or nurses, it's not. but it's a shambles.
Mm.
And if anybody can try to argue any other counter, then I'll demonstrate why it is such a shambles. And it's got nothing to do with people not caring. It's to do with government not funding. It's to do with a medical model that just isn't working. And it's to do with an abject failure in compassion. Because from my perspective, whenever I come to a scenario where an individual that I've worked with has had to be sectioned, the section is used as a threat. If a compassionate system uses the reality of committing somebody as a threat, that means that you're using it as a position of fear. If the mental health service that is there to help you and heal you is essentially used to threaten you during moments of crisis so that you voluntarily, for example, admit, that shows you that the paradigm is completely incorrect. And that isn't having a go at anybody within that service, because everybody I speak to in the mental health service knows those failures and wishes it would change. But the work that will need to go into that is profound and requires a huge amount of money, and also needs to accept that professional and therapeutic dynamics don't necessarily marry well, because as a practitioner who's therapeutic, you bring in deep compassion and kindness as part of your toolkit. And it's about really connecting and really synergizing and genuinely caring and wanting to help heal and go on a journey. It's not about locking people up or making people feel that I'm the professional and they know less than me. And unfortunately, that system is a highly academic system. And the problem with academia is that it doesn't necessarily come with a price tag of compassion associated to it, in my opinion. It's just my opinion, but that's certainly my opinion.
Thanks for that. Well, I wanted to touch upon that as well, because I don't know if you've probably heard in the past, or it's been in the news a number of times, where a lot of people with autism and learning disabilities have been locked up in these horrendous autism treatment units, and they've been, you know, I see them as, you know, bedlams from, you know, the 1930s. You know, I was talking to Norman Lamb, who used to be the care minister many years ago, and he was telling me on one of my shows that in Canada, they don't do anything like this. They treat people as human beings, and they work with the clients and work with the people with autism, and they don't have any of these, you know, pathetic units up and down the country, which they're building more of them now. And, you know, throwing a section on somebody with autism and locking them up. I remember one young lady, I don't know if you remember her, but she was actually a teacher, and she got autism, and she escaped the country, believe it or not. Her father got a flight to Heathrow, and she flew over to Africa because, you know, she escaped from being locked up. Why do you think, as a psychologist, and why do you think, you know, as a standing outside the box, why do you think the system's not geared up supporting people with autism, and not just that, locking people up?
Because I think one of the problems is, if you just look at Western medicine per se, we like to either see something as broken and then fix it. So when you approach things like personality or characteristics or temperament or particular classification as something broken, the automatic response to that was, well, how do we fix it? And then if we can't fix it, well, we don't know what to do with it, so let's just put it somewhere else. So you automatically fail to change the thing that needs to change, which is society and the way that we live within society. And instead, you make it an internalized problem for the person who's not able to fit themselves into the boxes that exist around them. And that's the major flaw, full stop, within mental health. So the idea is that we give the person who's exhibiting certain behavioral traits or certain mental traits and certain, you know, temperament traits, we'll give them that this is your problem. We can't solve you. Therefore, for your own safety, we need to put you here. As opposed to going, all right, okay, so this is this kind of person, they thrive in this environment, like let's make sure there's this environment so that they can thrive. And then how do we draw out all their unique, amazing talents? I mean, like you said, one of my friend's daughters is a really severely disabled autistic young person. She's like 19, but she's severely she has severe problems with her learning. However, in spite of that, so she's nonverbal and she has lots of problems with oversensory stimulation, and she also has lots of problems with her particular behaviors because of the fact that she has a desire to taste everything, including things that aren't very nice and those kind of issues. But she can do a 5,000 piece jigsaw backwards. She doesn't need to look at anything but the shape. So her mind is profoundly incredible, but our society will never say, well, what could this child, be it with all the other things that go on, what could this child grow into? How do we allow that part of her capacity to become something that is profoundly helpful to us as a society? And I think there are cases of that everywhere. You know, you see savants and you listen to savants, and while some of them have profound issues with learning in other ways, or at least certainly on an autistic level, a problem with communicating their emotional experience, which means that they can feel everything but can't express it to some degree. We again alienate that, because even though there's this brilliance, it doesn't feel like typical brilliant. Even though they're far more brilliant than any of us, it's the fact that they don't fit the typical box, and therefore it's like, well, you know, we could see you as probably one of the brightest human beings on the earth, or we could go, oh, you're a savant who's not quite fitting into our paradigm. And even when you get people who breach that, so the classic example of the man who can read in numbers, that was the documentary, the man who goes around and lectures now and has managed to deal with his autism to a degree that he's manipulated his temperament to be able to still do things that people would arguably go, oh, well, even though he is autistic and he can remember everything and learn a language in a week, he's also like us because he seems to be able to have normal relationships, right? So what we do is we have this typical expression of what normal is, and then we batter everybody into it. And then anybody who falls outside of it, instead of seeing that that is something that we should explore, much as we should with anything where the masses follow, we should always look at the extreme opposites, and we should look at the sidelines, because there's the interesting bit, the people who aren't just agreeing with everything else. So we should do that with humans. But the problem with our society is we've capitalized it. And a capitalist state is about how much can you earn, how much can you spend, how much can you earn, how much can you spend. So that's our system. So unlike in other countries where you'd still have people who are considered maybe soothsayers or shamans, or people with, you know, intrinsic abilities that are outside the realms of normal and typical, where they're welcomed and celebrated and sometimes really kind of seen as deities to some degree. In the UK, we're very capitalistic led. You can't go into an office and do the job that I think you need to, so you're not that worth. Or even if you can, you know, you're not socially making me feel comfortable. That's the other thing. You're not socially making me feel comfortable. So we have to have special schemes. We have schemes for people because you don't make me feel comfortable. So we're going to put you in that box there. So our whole system is corrupted to look at people who are not typical spectrum as being broken or wrong, whereas it's just that everybody is unique, and some of us have more unique tendencies that need to be and thrive in areas that we need to create and thrive for them.
So instead of some of these professionals locking people up, which they shouldn't,
you shouldn't lock anybody up. Nobody should be locked up.
Doing whatsoever. What do you think they should? The clinicians, the clinical staff, what should they be doing?
I think if a psychiatrist and psychologist were allowed to do what they wanted to do, they would do it completely differently. I think that they are prisoners of a system. I don't believe that anybody trains as a psychiatrist because they have anything but great intention. You know, you choose psychiatry when you could actually choose to go and be a cosmetic surgeon, one which will pay you £1 million a year, one which will pay you, you know, 90 or 100,000 pounds a year. You know, you choose a major disparity because you believe that you want people's mental wellness first as a priority. You know, whether I believe that the medical model and the more natural model has some synergy in between, I think there's something that works together. You know, one can't really exist without the other and vice versa. So I don't have any issues against it, but I think there's a different model. So I believe that people who are psychiatrists go into this world, as much as some of them might not be the most warm people because they're trying to figure out what is wrong with you, they're doing it because they fully embrace the fact that they want to heal. So I think that they would choose a different system. And clinical psychologists, I know so many, they're all burnt out. They are trying their best to keep people's heads above water, but they're sending them out into a society that doesn't really warm and compassionately embrace people. So whether you're even in primary sector, where you're dealing with people on a weekly basis, trying to keep their heads above water, and the amazing job that they're doing, they're then sending them out into a world where they're traumatized and they've not been given the right kind of stability, and they haven't got a lovely foundation of support, and they don't have economy, so they've maybe not got a job, and they don't have the right kind of food. So there's this whole like problem with intrinsics, the society and psychology of society, and that reflects it within the NHS. So I guess if you gave carte blanche to anybody, they would want beautiful holistic centres. They would want holistic centres where you go and heal. You know, like when you break your leg, you don't think, oh my God, I'm terrified of going to hospital. You think, get me to hospital, please give me the gas and air and inject me with something that's going to stop the pain. And you're really grateful, right? That's how you feel. That's the normal experience. I have asthma. I can remember when I had asthma attacks when I was a kid, I was just dreading not being at that hospital. I wanted to get there as fast as possible. They made me feel comfortable. I felt safe. You know, a couple of hours after I was on my nebulizers, they'd give me toast and a cup of tea, and I felt okay and happy. But if it's mental health, you are running in the opposite direction. I should be able, if I am mentally feeling stressed or strained or unwell, I should be able to go to a hospital with the same feeling of complete safety and sanctuary, because that should be the place that I go and experience that. And it's funny, when my dad was in totally the most horrific place, both on 2 occasions he's been there, it's an embarrassment to the mental health world, but I don't think it's on its own. His unit, they had people in there who were female and male. So firstly, a lot of people who are in the mental health system who are locked up, they are traumatized, sexually abused women who from the past have had horrific trauma. So what, we put them in a ward with men who are very, very unstable, not because they're going to do anything to those women, but imagine the fear that woman feels, you know, from being the child to suddenly being locked up with men who are, you know, sometimes violent, sometimes loud in their faces. All these things are happening. Then on top of that, they're treating schizophrenia, they're treating dementia, they're treating psychosis, depression, bipolar. They're treating it all on the same ward. Well, that's ridiculous. You instantly know that's about keeping people off the streets. It's got nothing to do with it. And we call it for self-protection, but it's not for self-protection. And very rarely do people ever want to go back. And when you do meet people who like them, so I met a few people who really wanted to be there. It wasn't because they wanted to be there. It's because they didn't want to be in their horrible life outside. So that's a very different situation. That had nothing to do with mental health. It had to do with 3 meals a day and not having to worry about who is paying for the heating. So that's a completely different reality. If you are a person from a reasonable life with, you know, a reasonable experience with your family to some degree, and you go there, you're terrified, and that shouldn't be the case. And with autism, you're adding a whole different level to it, because with autism, the problem is very often that you can't communicate your feeling in a way that the other person can connect with. So then it almost like stunts your language of expression. And instead of going, well, how do we allow that person now to explore it and express it in a way that's conducive for them? It's just, right, just keep them over there and let them out when we do A, B, or C. So it's really hard.
Well, the way I see it, I've been campaigning for 20 years now, but when I look over the last few years about these, these ATUs, autism treatment centres, what I actually see from, you know, sitting outside the box is that people with autism, people with learning disabilities, challenging behaviour, because of their challenging behaviours, the professionals, some of the professionals, I'm not saying all of them, but some of the professionals don't know how to deal with them. So what they'll do, say, for example, if Johnny has got just been diagnosed, a young child has just been diagnosed with autism, got challenging behaviour, and he's driving his parents, you know, absolutely crazy, and he's been aggressive and that. So what the psychiatrist will do is apply lots of medication on that child, give them antipsychotics, risperidone, and things like that. And if it all gets too much, the system just breaks down, and let's lock him up.
Yeah. And also, when you give a child that kind of medication, you arguably completely change the way their brain develops. And particularly the drug you mentioned then, you know, horrendous weight gain with that particular drug right there. So you then alter the way that they feel about themselves as well. So you have all of these additional issues. And the thing about any kind of behavioral issue is that there's always a reason behind it, and you have to find the reason behind it and locate that so that you can diffuse it. And once you diffuse it, you can work on a coping strategy. And the idea that people are always the same, and that's what you hear a lot of, he always does this, she always does that. That's just a complete myth. That's like saying to me, I always burn my eggs. I cannot learn not to burn my eggs. You know, of course I can. I learned that if I just wait 30 seconds earlier, I'm going to have runny eggs. That's what I can do. And it's exactly the same with behavior. I learned that 30 seconds before I'm going to kick right off, somebody is reminding me that I can compassionately have a cup of tea with them and just relax and take some time out, or sit down and draw a picture or do a puzzle. Suddenly my desire to act out in that behavior, which would have got the attention that I feel starved of, is no longer required. The idea that somebody is always a certain thing is one of the most misleading positions that we have within mental health. You know, the same as when people say, I am depressed. You know, you're not. You have a symptom that rears its head. With autism, it's I am an individual. I also have an autism classification, but I'm my name, and I'm my family, and I'm my history, and I'm my experience, and I'm all these amazing talents. And I also have a classification of autism. It's a very different way of looking at it, but it transforms the individual who meets you in that way. So it's a very challenging position right now in mental health. We're underfunded, under-resourced, undervalued, oversubscribed, and all following a system that's broken. So that has to change. And I know that when they're raising money at the moment for the NHS, and people are raising money for mental health, basically charity is having to support the absolute lackluster attention of the medical system in the UK, because the government doesn't care, and certainly doesn't care about mental health, and has never. I mean, look who the person, the health minister is. I mean, do we need to say any more? I mean, I wouldn't want to see her on a bad day. Simple as.
Thanks for sharing that. Some powerful stuff there, Emma. Thank you.
Pleasure.
We'll go on to the next section now, which is it's up on my screen, meditation.
Yeah.
I know you do a lot of shows around meditation and that, which is really good. In fact, not long ago, I was sitting in my garden and it's quite windy outside, and I was just lying down and I just closed my eyes, and I actually just, assumed, visualized that I was on a nice sunny beach and the wind was just blowing, even though it was the back garden wind. And, I did that for about 10 minutes and I got up and I just felt really good.
Yeah.
So
totally.
can you just tell people, viewers who are watching the show now, because a lot of people probably won't know what meditation is, what is it and what can they do, and what is the benefits of meditation?
I love meditation, and it's been part of my world since I was a very young person, and it's kind of taken different forms. So a lot of people think that meditation is an acutely spiritual thing, and I think that that can be quite divisive, because what people will say is, oh, I don't believe in like spirituality, whereas I always apply it in a clinical way. So anybody who does meditation, even if they struggle with it a little bit, you automatically start to calm your brain waves. It means that clinically you reduce things like cortisol and adrenaline, which are the hormones that make us feel stressed and anxious. And you start to release things like oxytocin, which is a really nice cuddle hormone. If you're lucky, some serotonin, which is the happy hormone. But one of the most important things is it teaches you in the long term to get into a state of flow. And meditation can be done in a million ways. So what you just talked about, lying in the garden, connecting with nature, being in the present, listening to nature blowing through your ears, that would be considered something like mindful practice, which is very much just allowing yourself an informalized connection with the world around you. It's paying attention to the here and now. It's about being fully present, and it's powerful because the only thing you have is now. Therefore, you are constantly powerful within it because you are allowing yourself to attend to that. Then there is more kind of traditional meditation, and I tend to do guided visualization. So I tend to tell a story and relax you first of all, and then take you on a journey. And for some people, that's brilliant. But others, about a third of people don't have an ability to imagine in their brain, so they don't imagine pictures. But with those individuals, they just tend to listen to my voice, and that will help to relax them, and that's usually to music. But then other people will meditate by using things like ASMR, which is basically anything from listening to somebody whisper to watching somebody cut through plasticine, anything that kind of connects you with just presence. And I guess when it comes down to more formalized practice, you can arguably put yoga into some kind of meditative state, because yoga is a very, very attended momentary experience where you really are connected to the present. But meditation can take whatever form that allows you to remove yourself from the, I suppose, anxiety and stresses of the future, the worries of the past, and bring you to the moment in the present. And it's an awakening experience. I always say to people who meditate, you might not think you're going to like it, but if you just stay with it, you're going to find things out about yourself that are exciting. It's about reminding human beings that you're so much more than human body. You have this incredible mind, and it can take you on the most limitless, vast journeys of just possibility and potential. And it's almost like you can be stuck in a place, but you can never be stuck in your mind. So it's freeing that, which means that you always feel that you have a place of escape. Those kind of things are how I value meditation and what I think it is.
So if somebody is watching this now, because obviously, as we know, the coronavirus is quite rife at the moment up and down the country. There's so many deaths, and there must be a lot of people out there who may not even have autism, neurotypical people.
Yes.
And they're very anxious about the coronavirus. What would you say to out them? Would you say the mindfulness is better, or the meditation, or a bit of both?
Anything you connect with, anything that allows you. Listen, for some people, meditation can be listening to classical music. That changes your brain waves. It's very relaxing. Piano, contemporary music is one that works particularly well. Trance music is also something. So if you've got a bit of a dance head on you, trance music is quite helpful. That helps to change the way that your brain interacts. So you can use whatever you require. For some people, meditation isn't even about doing something formalized. It's about going out for a walk and just taking time to look at nature. Anything that connects you to the here and now is really good at plugging you in. And I guess the reason that you should try meditation is, firstly, you have nothing to lose. And secondly, in this moment in time where we're feeling quite trapped, and a lot of us feel that there are powers over us, and a lot of us just want to go and see our families. And one of the things that I do every single night when I go to bed is I meditate, and within my meditation I go to a room where my father's waiting for me, and I talk to him about my day, and we both give each other a really big hug, and then I go back to my, I suppose, present human experience. So when you really connect with meditation, it transcends this dimension and another. It's not for 1 minute, by the way, me saying that I go off and visit my dad. In reality, I'm saying that what happens is the meditation takes you to a position where your brain allows you to have these quite intimate and powerful experiences with people who are no longer here, but it feels incredibly real, like incredibly real. You can smell him, I can feel him, I can hold him, I can say goodnight to him. And that's kind of one of the things that I think that if you're starting on a journey now, it's a perfect place. You need to escape. You've probably got conversations you want to have with people that either aren't here anymore, or that you'd like to see and can't because they're your family members, and meditation lets you do that stuff. And also, it's clinically proven to really reduce anxiety. It really, really helps. It really helps. And like, no one can keep you contained when you're free in the stars in your head. Because
there's actually been research done where they've actually put people through MRI scanners, when they're actually in a meditation. You can actually see the brain structure and the brain pattern, the right and the left hemisphere change different patterns. So it's incredible really what we've got. We've got a powerful thing which a lot of people,
our brain's amazing. But they believe we use 10% of it. Obviously we used it all different areas, but only like 10% at once. So we're only ever using one area 10% of the time, each time we use that area. And you just think to yourself, what is that symbolic of? And of course, when you have people like savants, then that they're obviously using bigger areas of their brain. And it's always a little bit of a sad thing for me that I can't figure out how to get into the areas that those people have just got natural inclination. Because I think to myself, the brain has to be that way for a reason, and the capacity is just intense and limitless. And yet I'm really bad at maths. So I just feel like if I could tap into these areas, it would be amazing. That's what I love about the whole East meets West, because you can now see genuinely demonstrated the impact of mindful practice or meditation. And you're absolutely right. We can see the way that the lights dance around the brain, and how the left hemisphere, which is mostly used for our logic and literacy and our that kind of reading expert, and then our right being more the creative, artistic, singing. So when you're using both of those and you're using them effectively, it's giving your brain a workout that you wouldn't ordinarily do. So it's healthy in that respect as well. Certainly when you look at studies on things like Alzheimer's and any kind of degradation of the brain, people who do things like meditation often fare better, because it's like we keep the neural pathways exercised.
Well, I was just mentioning the other day on one of my shows to presenter broadcaster Carrie Grant, and I was saying to her that I've started taking up singing, not professionally.
Who cares?
Just using the Smule app. But for me, when I actually sing, even though I can't sing, I'm absolutely terrible. I'd admit it. But for me, when I've stopped singing, I just feel so good.
Yeah.
Why is that? Why is that?
Well, I mean, there's a few things there. Firstly, singing is a subjective activity and should be without judgment. Just because you don't think you compare to, Alanis Morissette or Barbara Streisand doesn't mean that you don't have the absolute worth of the experience. It's the doing, not the sound, that actually matters. I suppose one of the most important things is being liberated as a human being is one of the most powerful states. And it's hard, We want to be liberated. We want to be free. We want to surrender to who we really are. But we have a lot of constraints around us. I mean, you just have to see what happens if somebody is free on social media, because you might say something and then a million people will tell you that you're a fool. So we have a lot of people who are policing our behaviors. But when you allow yourself to just be authentic and let yourself do something that makes you feel good, like singing is such a creative exercise. I sing and I love it. But also it just reinforces, I think, a childish freedom in us. I think that's one of the things that singing does. When you think about the days that you really, really did sing, it was in the school morning when you were in assembly, usually primary based. You were having your best life. You were singing with your friends. You were singing hymns that were fun, or you were singing songs that were fun. And then you tended to do like a choir thing in the week with the music teacher. And it was all based around fun and experience without fear. And I think that we learn very, very quickly when we get to high school how to be a acceptable human being. And it means being quiet, or it means being cool, or it means fitting in wherever we can. And when you get to a certain age where you can unashamedly and unapologetically just be free, you've made it. And don't get me wrong, I'm still on that journey. There is so many things I would like to say that I know I still haven't got the courage. I know I'm getting there and I'm trying harder to do that. But because I get policed, if that makes sense. I say one thing, and I don't get to be on TV again. I do one thing, I don't get to do that again. So I'm policed in a way that is hard to manage sometimes, if that makes sense, because there is a real voice in me that has to still manage itself as well as it can to prevent damage that I could do to myself and my career and my family. So things like singing or dancing or being stupid with your old friends, that's what connects you to what matters. I recently reconnected with my best friend. I had one of my closest friends died 3 years ago, and it was hard. And she was my best friend from being 7 years of age, but she was part of a quad. So there was myself and three other girls, and one who I was massively close to. I would say she was like my best friend at high school. And we reconnected. And it's really interesting because I haven't seen her since the childhood, since she left our school at 16. And yet when we speak to each other, we return to that position. So we forget all of what has been as adults, and you go back to that position where you were just insecure about boys or worried about your hair, but also really excited about possibilities and really hopeful about the world. And it's an interesting experience to explore yourself in different paradigms at different times. So I think, yeah, a very convoluted answer, but I think that singing and the expression of singing comes from the freedom and playfulness of being a child and what that means for us all. And we should all sing as much as possible. And actually, if anybody, particularly if you're from the autistic community, if you really want to work on, yes, I know social constructs can be difficult, you know, can be overwhelming at times, but choirs have been shown very, very repeatedly, particularly rock choirs, where it's all about really connecting in that way. They've been shown to really help inspire confidence without bringing you that need to have loads of conversation. It's just about going in, having fun, singing a song and getting yourself out. And I think that everybody should try that. If you have something like a spectrum disorder, that would be really, really helpful.
So we had a lot of questions this week around parents who've got children with autism who are in this lockdown at the moment, and they don't know what to do. They don't know how to, you know, because they can't go anywhere like the supermarkets or McDonald's, which is like routine for a lot of children, or, you know, going on, you know, their normal routines.
Yeah.
What sort of advice could you give them to help their you know, their well-being, their mental health?
So,
you know,
I mean, one of the things that I was asked the other day on my clinic, which again, it's not my specialism, autistic children, but there was a 9-year-old boy and his mum got in touch and said that basically he hadn't been out of his room since lockdown began. He was just refusing to come out. He was refusing to take his medication, and he was refusing to eat a lot of the food that she was presenting him with. And what I suggested was that the complete juxtaposition from being in school to being locked down. She also said he wasn't believing that she was actually locking him down for a reason. He was struggling with that truth. So there was this really big culmination of issues there. And what I suggested was it was too overwhelming for him to go from school to nothing and to be stuck inside, and to try to formulate routine in a way that he was used to. So she had to get him up at the normal time for school. She had to get him in his school uniform. They had to place a place downstairs where there was school orientated. He needed to be served his lunch in his lunchbox. He needed to have breaks at the break time, and then the medication at the same time that he would have every day. And then over the next few weeks, she can scale that back just a little bit, so that then maybe he isn't getting up at 8 o'clock in the morning. Maybe it's going to be a little, as he gets used to it and trusts her. And also she agreed to show him FYI, which is a young person's news show, which is really friendly for kids, but also evidences what's happening, so he could hear it from his peers. Now, she got back to me last night on my live clinic and she said it's gone really, really well, and he's started to really adapt to that. So I guess that in my limited experience, when you have issues with routine, when you really do like to know what's happening, that's part of your emotional cogency, that would be something I'd suggest. Also, as you know, if I take one autistic child and I put them next to another autistic child, the chances are they'll have more in common with the non-autistic child than the person who's autistic beside them. We know that. So it's not a one-size-fits-all. I guess reassurance beyond measure. I spoke to a child consultant psychologist, Dr. Peter McParlin, about this, and he just said, as much reassurance, no matter how many times I need to ask you 100 million times a day, just say it's going to be okay. Say things are going to go back to normal. Say they have nothing to worry about. And he actually said, listen, you're being told, be honest with kids. In his opinion, he was saying, no, what you need to say is, everything's going to be fine. You're going to see your grandma soon. You're going to go back to school and see all your friends. You don't need to worry about your education. It's all being taken care of. This is a lovely little time where we can reconnect and bond. And how can we make your day feel like it's a day worth living? So I think that probably approach it from that child-centric perspective and you'll get a better result. But like I said, for me, I kind of, on the hoof the other day, thought it would make sense to me as a child to have something that felt similar to my experience at school, and that apparently worked really well for them.
So it's a matter of being positive and upbeat about it, and I suppose
yeah, exactly. Yeah.
You've had some
but it's a bit like with you, you know, I'm speaking to you now. What's quite frustrating, I think, for people with autism, because it's such a vast spectrum. If I was to put you in a room with 10 people and you were chatting, I guarantee not one of them would say, oh, that individual understands autism or has autism, right? Because everyone has a perspective. And that's really the big problem. The perspective is so skewed and misunderstood that even when people are, I have quite a lot of friends, for example, who have been classified as adults with autism, but they've gone their whole life thinking that they are socially awkward, that they have problems with crowds, that they struggle in shopping centres, and they're just a bit weird, as they put it. And only as adults have they started to realise that there was nothing wrong with them at all. It's just their experience and temperament and development is one of spectrum disorder, but it's not something that's broken. And I think that more and more people need to realise that your friend who's a little bit awkward in social situations probably isn't that awkward at all. It might seem that way, but you might be dealing with somebody who just has a spectrum disorder, who actually, with the right understanding and navigation, and maybe not going to that really loud bar, maybe not going to that really crowded one, suddenly it's a perfectly lovely environment for all of you. So it's kind of like learning that language. And I constantly have to learn the language of my clients. And I always think that I'm the one learning. I don't ever think that they're being taught anything by me. My constant experience in therapy has been, you walk into my room and I'm the one who's the student. It's as simple as that. Like, on the way, hopefully I will be helpful navigating you on your journey, but I go away, I know every time, far more in I suppose embraced in my learning and my experience because of my time with the clients. It's such a mutually reciprocal experience, probably more on my part than theirs.
Yeah, we've just had some questions come in. We've had one. My question is to Emma. Why do some people with learning disabilities suffer with psychosis in their mental health?
Well, I mean, psychosis is a really interesting one. And the reason I'm going to say that is because my father has psychosis. So I know it well. He had it once in 2000 and he had it last year that killed him. And it killed him. He didn't kill himself. Psychosis killed him.
So can you tell people what a psychosis is? Because Jean's getting the question in.
Okay, so psychosis in the medical sense, in a medical context, is when people have what would be considered a break from reality to some degree, i.e., they could hear voices, or they could see people, or they could smell things, and their thoughts become highly distorted. So this could take the form of very suspicious thinking. You might be paranoid that your family is trying to steal from you. You might believe that you've done horrible things, like you might want to take responsibility for the First World War. You might say that you're as bad as Hitler. You might believe you're a paedophile. These are all things that psychotic people can experience. Psychosis is debilitating, terrifying, and feels as much and as real as you and me talking right now. So when you're trying to help people understand what psychosis is, don't imagine that they're making something up in their head. It is as tangible and as auditory and as smell orientated in times as being in the room with somebody. So that's how terrifying it is. And then the reasons for psychosis, everybody has different reasons. The psychiatric will say that it's to do with chemical distortion or brain disease, for example. So if you've had learning disabilities, you may have been heavily medicated. That could be a reason. Heavily medicated human beings have a bigger tendency to have psychotic breaks. So you'd need to look at your pathway and what's created you. Secondly, what's happened in your life. And people with respect who've had problems of vulnerability have often been put in places of vulnerability. So therefore, if you are not cared for or brought up by your family, or you are being in situations where people have access to you and you've been traumatized by their behaviors towards you, then arguably, again, that could feed into trauma, which then can help to precipitate that break from reality. Then there's the DNA argument, that you have a subset DNA that can be actualized through periods of stress, which certainly people with learning disabilities will experience because the world is not set up to manage them. However, on a spiritual level, I believe that psychosis is also a mental reaction and rebellion to a system of living that isn't effective. So a gradual disintegration of connection with reality based on the experiences leading to whatever it is that has broached that and breached that to create that action. And I think that the way that we deal with psychosis right now is through antipsychotics, which have got a whole heap of other issues, and antidepressants and anti-anxieties. It's incredibly medicalized. But if you look back, even before we were medicating people, people would have breaches with reality. And then as long as they were given the right kind of care and not institutionalized, usually, they could very, very quickly formulate understanding that this is something that they were experiencing, but that would pass, and with reassurance and connection and love, that they would be soothed by it. And certainly my own father, when he was having his psychotic breakdown, what caused his death ultimately was a fear of going into hospital, because it was so terrifying for him. And one of the things that I learned, if you have somebody who's got a learning disability and is also dealing with psychosis, help them to understand that you get how scary it is. So instead of rationalizing and telling them why they're wrong for the delusions, don't do that. It's really, really, really confusing. It's like me talking to you now and then somebody saying, Emma isn't there. And you're like, Emma is there. And they're like, no, she isn't, because I can't see her. It's as unhelpful as that, because you can see me. So therefore, that person's now a liar. So what you need your family and friends to do is to be like, I can see Emma. And they would say, oh, okay, that must be, tell me what's happening. What's she doing? You know, be in it with me, or Emma's scaring me. And you'd say, that must be really scary. How can I help you to feel easier with this situation? So instead of rejecting your world, I meet you in it. And that's something that's really important. And the biggest reason why, listen, I have no idea why psychiatry is still the one place that seems to be a guessing game. Like, you don't go into hospital with a broken leg and people go, I think it's a broken leg. They x-ray you, they figure it out. Why with any kind of brain stuff do we go, oh, hang on a minute, we're going to do a bit of a guessing game here. Tell me these answers, which are ridiculous, because your experience and my experience, we come from different worlds. My understanding of what you're asking me is different. And then suddenly I'm bipolar, and then suddenly you're autistic, and then suddenly you're schizoaffective. We have the instruments to see the brain. Let's figure that out. If we really want to make a difference, let's look at the way that our brains work and look at how we can make them work without necessarily plumbing you with things like antipsychotics, which the biggest regret I have is that my father was given those.
Sorry to hear that.
No, it's all right. It works really well for other people as well. That's what I'm talking about. Subjectivity and treatment plans should always be universally acknowledged as an individual. I have watched my best friend, my best male friend, do 10 years in analysis. That man has analysed himself within every inch of his being. He had highly suicidal behaviour, highly depressed behaviour. And in the end, I got him to a private psychiatrist. That psychiatrist evaluated him as bipolar type 2. He went on the right medication, and his life in 5 years has been beautiful. So I am not against any model. I'm just against the way that we figure the model out. I think we need to do a better job, considering we have the most amazing technology. You don't go in with a brain tumor and they go, let's just have a guessing game about where we remove this. You figure out where it is, then you remove it.
We've got lots of questions coming in. We've got one, excuse me, on Facebook here. Anna says, absolutely agree. Mental health issues should be discussed more.
Yeah, definitely. Definitely.
Yeah, and she also says, thank you, Emma, Kenny, enjoying this really important talk. Thank you.
Oh, thank you.
So we've got Gemma says, hello, Kevin and Emma. Thanks, Gemma, for joining us. We've got lots of highs here. We've got one from Cassandra. Cassandra says, this is very relatable to me. My daughter has just been a mental health inpatient.
Sorry about that, Cassandra. That must be really hard.
Yeah, she's not autistic, but was not listened to. A practitioner said to her last week that one of her diagnoses would be preferable to another, as it wasn't a lifelong condition, even though my daughter and I feel that this diagnosis doesn't fit to her at all. What would you say about that, Emma?
I would say that evidences the hypocrisy. This idea that once you've diagnosed something, the response is, well, you'd rather have that one because the other one's really bad. I mean, as if that would be the resolve, because even if it happens to be, let's say you say, well, actually what you have is a period of psychotic depression. So a period of psychotic depression is intense, it's acute, it's very distressing, and it can happen once in your lifetime. and that can be it. And you'll never get it again. You know, my dad got unlucky, he'd had it once, the sepsis triggered it again. But the point was, most people, you'll get lucky. So that would be preferable to schizoid affective disorder, right? That would be preferable, because, or a psychotic disorder recurring. I would rather it be that. However, the idea that I'm going to go, well, let's just hope that's the one, and we'll just classify you that way, when it might not be the other one. The idea that human beings cannot manage information and accordingly deal with that effectively underestimates human beings. I don't want you to tell me that the lump on my wrist is just the bruise when it's cancer, because I might struggle with the cancer diagnosis. I want the treatment protocol, I want the information, I want to learn about how I can deal with this better. I think when you are given a classification, the classification is your starting point. What you do with it is up to you. And one of the most important things for young people is to recognize the plasticity of the brain is constantly changing. You have a right to disagree. If you don't feel that the classification, when you have lived your whole life to that point of being that person, if you don't think that that professional who's known you for a blink of an eye in time is correct, the likelihood is the blink of the eye in time is incorrect. It's a blink of an eye. So know your power. You have a right to completely reject it. You have a right of a second opinion, and you have a right to consistently try to find a better place to deal with your mental health and wellness. And it's like BPD. When I was first trained, before I went into the therapeutic dynamic I'm in now, BPD, it was basically the same as schizophrenia. You were told, well, that's it forever. So there was this idea that BPD, you were always going to have personality disorder, nothing you could do about it. You'd never be able to learn to self-regulate and all those things. Excuse me. And now we know that that's just not true. As most practitioners have always expected, if you've had significant trauma and you then develop BPD, it's a traumatic regulation response that can be dealt with in the right therapy. It just means finding the right therapy. Even with schizophrenia, like some people who are schizophrenic have very rare episodes. Some people have acute episodes constantly. Why? Why, if it's the same disorder, is it so different? So surely we should start looking at what is it about the individual and what has been within the individual's experience, bringing them to that point. How does that person respond best, and in what situation do they thrive? And then how do we apply that technique is my answer.
On Facebook, it's lack of basic understanding.
Yes.
She also says she's got autism as well, and we are treated like we are damaged.
Yeah, we are treated. Yeah, you are. A lot of the time. Listen, when I had an eating disorder, I had an eating disorder when I was a young person. I had it for a very long time. I was treated like I was damaged. And then when I didn't fit the system, they asked me to leave outpatients because they said I was disruptive. And the reason I was disruptive was because I had an eating disorder where I didn't want to eat. And they were trying to get me well by giving me practitioners who were very overweight. Now, that might not seem like a nice thing for me to do, to say, I don't want to learn from you, you're overweight, because they weren't doing overweight on purpose. It was just who they are. But the point was, that was my biggest fear. Why would you put me in a situation where the people who are meant to be teaching me health aren't healthy? It felt like it was too much of a stretch. What you needed to do, you needed to put me in a room with mentally healthy and physically healthy human beings so that I could identify a desire to be like that. And instead, the response was, there's something wrong with you, you're disruptive, you're not coming back. So the minute that you don't allow yourself to fit that paradigm, the paradigm is shifted. So they're the things that happen day in and day out, and you're right. And the thing is, what you've got to do in those moments where you think that you're the person being persecuted for being who you are, just remember that no mass amount of people in the world, no big voices ever change the world. It's always the individual who's a bit different. It's always, it's always the individuals. It's Alan Turings of this world. They're the people who change it. They're not people who fit. To fit is not a great thing. I don't fit, and I don't want to fit. When I was a child, I was atypical. I had horrendous vocal and physical tics, which is why I move my hands a lot, because I still have tics. And I don't want to be anything but this. I like the fact that I'm a little bit quirky. I don't want to be typical. I've never been typical. I physicalized my anxiety, whether that was through ticking like I do now, and when I was a child, whether that was through an eating disorder that was a really bad coping strategy. But I physicalized my unmanageable feelings. We all have our ways of coping. And the difference between, I think, me and other people is that I had like a dad who literally applauded me for crossing the road. Like literally, I was so stupid at school. Like I was not a bright kid. I was really not a bright kid, and I was weird and I was very awkward. But my dad would see me, and whatever I did, he was like, you are the best at doing that, you know? And I wasn't, but he gave me a sense of, if I could be a hero in his eyes, then really I didn't care that much about the fact that the kids thought I was a little bit weird. And as I grew into myself, I realized that my little bit weird was what made me different than other people. And what my little bit weird allowed me was to know that when they were all wanting to fit in, I'd be over here finding a door that nobody else had thought of. So I think that instead of being afraid of your weird, or we call it typical or atypical, that's the PC. But let's be honest, we're just a bit weird, and it's great. I don't want to be normal. I think normal's terrifying. The word average scares me more than being called atypical. You know, never. Forget
it. Timothy says we should not have to...
I can't hear you. I can't hear you.
Can you hear me now? Can you hear me?
Hang on.
Can you hear me? No.
I hear you.
Oh, no sound. Oh, no. Let's just try. Can you hear me now? No?
Yeah, I can hear you now.
Yeah. All right, great. I don't know what happened then. It's technology for you, Emma. Timothy says we should not have to teach staff about autism, and you're quite right there, Timothy. No, and it should, you know, it's, I think parents sometimes, as well as people with autism, have to teach the professionals.
Oh my God. I mean, I worked in education for 15 years, and it used to horrify me, the fact that the kids that I work with, they often didn't have parents who were that caring. So imagine them. Like, I'm used to seeing parents who have to fight tooth and nail to get any kind of acknowledgement of what the child needs so that that child feels that they can thrive. And I used to work with kids whose parents weren't even involved. So I know what the system's like. And I don't toe the party line. I won't say what people want to hear in the public domain where I'm nodding my head and agreeing how great it is. It isn't. And the thing about teaching is that for teachers, it's really hard. I mean, they have to be mental health practitioners. They have to be, you know, advocates of health. They have to be people who are specialized. Like, the truth is, we need to allow schools to thrive so that kids can thrive within them, and that's involving not this academic one-size-fits-all system, and having specialists who understand children's worlds from all different frameworks, even the ones who were like me when I was a kid, or like you. That's how a great environment is. And if you ask most teachers, the good thing about teachers is they're always on the same side. If you speak to a teacher, there's not one teacher in the country that goes, yeah, the primary system and the secondary system is the best system in the world. Every single one of them is like, can children just play for a while in primary school? Can we stop having to sit to these 6-year-olds who are exhausted and don't want to learn maths? Just let them play. Not one teacher would be like, that's a terrible idea. Don't let them do that. You know, so if you actually listen to the experts, and teachers are experts, they don't get the right training as far as special needs go, but they do have a really good understanding of what would work. And it's never, let's follow league tables and do sets. I mean, that no teacher said ever in the whole humanity of teaching, you know? So I think that parents will always have to lead, because the thing about you as a parent is, you know your intrinsic worth of your child, and you also know their intrinsic ability, whereas school can only measure a tiny paradigm. Whereas a real fantastic quality of a parent is you see the thing that stands out within your child. That's what's frustrating for parents. You'll go into school and they'll say, okay, he's doing really average or she's doing really badly. And you're sitting there thinking, if you could see the way that my kid entertains me at home, don't tell me they're failing. And my youngest son's an example of that. He's not academic as far as he's bored and disinterested. He is the funniest kid you'll ever meet. He's hilarious. And to be told that my child isn't as clever as, when actually what they're saying is, sorry, we've got this really terrible system that no child with any character can be measured in, you know, you've got a problem. That's so unfair. It's wrong. So teachers and parents, like, the synergy is there. They all want the same thing. But the problem that we have is that they can't measure our kids in the current system how they should accurately be measured, you know? Like, why shouldn't kids who make cakes be measured because they make good cakes? I mean, it's like, that's a really good talent, you know, or they draw well. Like, just let them be kids, or they sing. That's just as important. I mean, who makes money in our society? You know, the celebrities who were there, they didn't have to go in and do a spelling test for the audition, did they? They sang and then they became a millionaire. Miss Hargreaves in year 11 was wrong. Do you know what I mean? It's like...
Sean on Periscope says, I've never been diagnosed with what I believe because I'm still not me. Thanks for doing this.
Yeah. I mean, I know Sean. Hi, Sean.
And Cassandra says it's unacceptable to make a person believe that they cannot recover from a mental illness.
Ridiculous. It's ridiculous. And if we did it anywhere else, it'd be bizarre. If you walked in and said, you know, what's wrong with you? Well, I've got cancer, and they were just like, well, you should just stay with that forever until you die. It's like, people are like, well, how do we change that? How do we shift that? It's because we don't spend enough time thinking about mind. That's the problem. And we don't like talking about mental health, which goes back to your original question. And we get lost in the fact that the thing about mental health, and this is the difference. Mental health is all about brain. Brain is where you belong. So your personality is somewhere between your brain and your stomach, I always think. You know, that's your personality. But the problem is, unlike in every other area of medicine, you get in the way where mental health is concerned. I don't mean you're the problem. What I'm saying is, you get in the way. So like, there's not just the brain, there's this whole personality around it. So you have an issue, but somebody says to you, well, do this. And then you're like, well, I don't really like the idea of doing that. And then they're like, oh my God, this person is impossible to work with. So the bit of you that it makes you, that is defined and important, because you don't think that fits, you're the problem standing in your way. And it's ridiculous. So we have to see that the reason that we don't do a lot of good work to some degree in mental health is because to actually make it happen, the person being treated has to think they are an expert and they totally understand me and they really like me and they completely understand where I'm coming from, and they listen and they confirm that it's okay that I have these feelings, and they seem to be in a position where if I connect with them and go through this with them, we're going to get somewhere effective. That is all required before the bit of me can invest in the bit of you telling me that I can get well. So before we even move forward, there's a lot of work that needs to be done. And the truth is, the resources are so low and the compassion is so low that we never get there a lot of the time, unless you're very, very lucky and you have a lot of private health, or you go to a hospital where you are just very fortunate enough to have a group of individuals who aren't burnt out, aren't under-resourced, aren't underfunded, and have time and space. So when you look at older people's mental health services versus children's, you know, CAMS is, I know that they're very burnt out and overburdened, but CAMS are quite creative. They try to get quite a lot of stuff. They've got play therapists, art therapists, you know, there's a lot more work done creatively there. And they seem to have a bit more of that, even the locked up kids, there seems to be a bit more of that camaraderie and, you know, we're the same. And they kind of, the youth almost to some degree gives them at least a little bit of a challenge to connect in that way. But when it goes up and above, yeah, I mean, you're really screwed then. I mean, and I'm not saying, by the way, that children's services are great. I'm just saying they're better than terrible, if that makes sense.
Mm-hmm. Emma, thanks ever so much for joining today, and thank you for sharing all your wealth, information and knowledge and expertise.
Anytime.
Where can people find out more about you and about the meditations?
So every night at the moment, bar like a Saturday night, I tend to take Saturday night off. I do around 9:30, I do a meditation for half an hour, 20 minutes, half an hour at Emma Kenny TV. Also, I do Monday, Wednesday, Friday clinic, which is about 8:30 till 9:30, which is all about questions. If you've got questions, get in touch and I'll answer them. If you've got problems, share them, join my community. But most of all, just like I said, if there's one thing that I think every human being should recognize is that we're all a little bit weird and embrace it. It's great. It's great. What makes you unique, right?
Emma, thank you so much for joining us today. Have a great day.
Yeah.
Thank you.
You too.
Bye.
Bye.
Bye. Bye.